I couldn't do it. I couldn't keep charging people double what they pay at Budget Breaks.
Budget Breaks. Alignment starting at just $59.99.
Take your car to Budget Breaks.
I think probably most of us wake up and in the course of our week have a conversation either with family, friends, or neighbors about, are you going to get the COVID vaccine? And if so, when? Have you gotten yours yet? How did your second shot go? There are an awful lot of questions that a lot of us have, and thank goodness we can hopefully provide you some of the answers you're looking for this morning. Dr. Fernando Urrego joins us. He's with the Hamilton County Health Department. Good morning to you.
Good morning, and thank you for having me.
I'm right, aren't I? That this is kind of the topic of conversation among everybody, regardless of your age.
It definitely is. It definitely is.
So you've got a system in place. You're doing everything you can to kind of publicize it out there. I guess the number one question, though, is where do people start? If you're in line and in the right category to get the vaccine, where do you go to get it?
So the best place to go, if you meet the criteria that we're currently doing, so we're currently in phase 1A1, 1A2, and in terms of the age bracket, 70 years and older. So if you meet the criteria, the best thing to do is to go to our website at vaccine.hamiltontn.gov. And on that website, you'll be able to make your appointment when they become available. For those of you who don't have internet access, you can call our appointment lines, both for the first dose and the second dose. And I'm going to give you these phone numbers. For the first dose, it's 209-5398. For the second dose is 209-5399. And for our Spanish speakers, we have a line as well. It's 209-5384. So when your turn comes up, if you meet the criteria, please go to the website or call the appointment line.
Well, let me ask you something, as much as you can, speak to it on when your turn comes up. I've likened it a little bit to when you're boarding an airplane and they call aisle seats, rows this one to this one, but everybody tries to get on. If you have some kind of a pre-existing condition, should you go through your primary care doctor to make sure that it still is enough to kind of bump you to the top of the line?
I think that's a great question because we still get calls with people saying, well, I have a chronic illness. I think my turn should be up. We really try to stick to the state vaccine plan. So if you have any concerns, if you think that you qualify or you should qualify, what we suggest is that you definitely talk to your doctor, have the conversation, and then go to the website. And if you meet the criteria, make the call. If not, like when you board the plane, we ask you to wait till your row is up.
Okay, I don't have a ton of time. Tell me this, true or false, we'll play a game. Once you get the vaccine, both of your shots you've gotten, does that make you immune from COVID?
So after your second shot, the answer is true. After about 2 weeks of your second shot, you are presumably immune. So true.
Okay, but you can still be a carrier of it, correct?
Yes, and that's the important point is even if you get your vaccines, you could still get the virus and transmit it to other people. So even if you get your 2 vaccines, make sure you continue to wear your mask, make sure you socially distance, wash your hands, and avoid large groups.
Okay, so if someone has scheduled their vaccine, let's say that they're set to get it now on March 1st, their first one, do they have to kind of quarantine for a little while before they get it? Any kind of prep work to be done prior to receiving it?
No, so the sort of the guidelines remain the same whether you got your first shot or whether you've gotten your second shot, or if you're still waiting for your turn to come up. We need to continue to follow the CDC guidelines to wear the mask, to social distance, and to wash our hands.
Okay, if you want to then, I know we're obviously updating the public here on Channel 3, all the media outlets are, about when the next phases kick in, but the website that you gave us, the vaccine.hamiltontn.gov, is that something where we can also access when the next phases become open?
Yeah, so if you go to the health department website, to the part that says connect with us, on that page, all the information of which phase we're on, what age bracket we're on, all that is there.
Okay, and then I guess I'll just let you give this plug that we've all learned so well. until it's available to everybody, you're still encouraging wearing those masks?
Definitely. It's, I can't re-emphasize that, even more so now where we have some other variant of the coronavirus that spreads easier. So continue wearing that mask.
And we have
a long way to go.
Literally 30 seconds left. It's okay if you don't have an answer, but is there a hopeful date when everybody will have had an opportunity to get the vaccine, or is it too early to make a guess?
I think it's really too early to know for sure. There are too many moving parts to all of this. So, what I'll say is just be patient, wait for your turn, your turn will come.
Well, you have been excellent. Thank you for the honesty this morning.
Thank you for the invite.
What's in Zaxby's new General Tso's sauce? Legendary chicken, legendary sauce. The new General Tso's boneless